Good morning. Good Wednesday morning, September 24th. Welcome in to Fitz the Bill. Appreciate you clocking in, getting your day started with us right here on 106.1 ESPN Richmond, the ESPN Richmond app, and of course, ESPNRichmond.com. And we are streaming live on Twitter, Facebook, and YouTube. If you want to watch the stream, just type in ESPN Richmond in the search bar. We'll pop right on up. And you can watch live. You can comment, like, and subscribe as well over there. And drum roll, please, because we got our phones fixed after having some weird issues with our phones the last 2 days. We've got them fixed, so feel free to call or text in throughout today's show, 804-327-0888, and you can be part of the show this morning. And of course, you can text. We love texts, and you can do that throughout the show. That never broke, but our phone lines did unfortunately break. We're going to go out immediately to start this morning. We are joined now, Dr. Corey Resnick from OrthoVirginia. He's taken some time out of his morning to join us and talk a little bit about some hip injuries this morning. Doctor, good morning. How are you doing?
Good morning. Good. How are you?
I'm doing fantastic. We're talking a little bit about hip injuries. So that's the fun thing of it. And with Jaden Daniels, and we're diving right on into everything that's happening. And I know you don't work with Jaden Daniels, just coming from a place of expertise, but the knee and hip seem to be kind of somewhat aligned. How could playing on an MCL sprain in the case of Jaden Daniels potentially go on to impact his hip?
Yeah, so certainly a lot of this is like indirect effects. So a lot of the muscles that you use for your knee or your hip cross both joints or sort of start by one and end up by the other. And so certainly if you're compensating for an underlying knee injury, it could certainly throw off the way that you're weight bearing through your hip and can aggravate things around the hip as well. And so there's very few movements that athletes do, people do on a normal basis where you're moving your knee sort of independently of your hip. And so certainly if one is not correct and there's an injury with one, it can certainly lead to some issues with the other.
So with that, so far in the NFL season, knock on wood, there haven't been a ton of hip injuries. You kind of talked a little bit about how the knee and hip work together there. But in total, how do you typically see a hip injury occur?
So probably in sports, in football in particular, a lot of it is either like a strain or a tear. So like football's an explosive sport. People are starting, stopping, cutting, doing things like that. And so whether it's a hamstring injury, a hip flexor, things like that are things that you could strain, you could pull, you could tear. Additionally, things like direct impact. So helmet to the hip area, shoulder pads to the hip area can all cause things like hip pointers. People will get some contusions or bruising of the bone around the hip and lead to sort of other areas like that. Those are probably the more common ways that people get injured there.
Dr. Corey Resnick from OrthoVirginia joining us this morning. And Dr. Resnick, can you explain what a hip pointer is? Because I think we see that a lot popping up on injury reports. What is it just a fancy word for a bruise? I know you said contusion. What exactly is a hip pointer?
Yeah, so it's one of those things that, it sounds like a big fancy word, but basically it's a bruise of the bone, sort of around sort of the top part of the hip. And so it might be an area that, might be a little bit undercovered with pads. And so people take a direct shot there. That can lead to something that is more painful for a longer period of time than if it was, something more sort of in the muscle. Like a deep bruise can certainly be painful for weeks, sometimes even months.
I think we need to change the name of that and then turf toe as well.
Exactly.
Turf toe sounds so nice. And it's like a tear of ligaments in your foot. That just sounds horrible. We need to go on a rebranding mission for those two. In the case of NFL athletes, and as a reminder, you're not treating the NFL players, just sharing the knowledge. What types of hip injuries should football fans be scared of when their favorite player may get a hip injury? Because it just all seems so like a hip pointer, like you said, it seems so like, oh, that's fine. A hip bruise, that's fine. But when it pops up on an injury report, what type of hip injuries should a football fan be worried for their favorite player?
So I think sort of the two big categories of things to be concerned about would be things like inside the hip joint itself, like the ball and socket aspect of things, where you could have a cartilage injury, you could have a labral tear, which is kind of like the outer lining that sort of provides like a suction fit and keeps sort of the femoral head, the ball in the socket. That's an injury that would be fairly serious for an NFL athlete. Additionally, anything if it's not like a strain or a sprain, but is listed as being a tear, that would be more concerning and potentially, longer timeout and, potentially something that was operative.
Dr. Corey Resnick from OrthoVirginia joining us on this Wednesday morning. And how do you go about examining an injured hip?
Yeah. So a lot of it depends on the situation they're in. If it's, something on the field versus in the office or the sideline, like if you're on the field, a lot of it is going to be quicker. Like your goal is to get the person safely off the field, assess, quickly, is there a concern for a break? Is this person able to weight bear? When you get them to the sideline or the office, the exam can be a lot more detailed, looking for deformity. Does it look like the leg is crooked? Does it look like there's a lot of bruising, swelling, things like that are abnormal? And then a lot of it is done on an examination table with the patient flat, and you can really test range of motion, strength, and sort of get a sense of, is this injury something inside the hip joint itself, or is it more the surrounding soft tissues, muscles, tendons, things of that nature?
What are the most common hip injuries that you come across?
So in my practice, I deal a lot with hip arthritis. And so it's a lot of degenerative, chronic overuse injuries where people, they get a lot of cartilage injury over time. And that's essentially what arthritis is. With that, a lot of times people have associated tears of their labrum. And so depending on if there's arthritis or not, a labral tear in isolation is something that you could repair or you could debride in younger patients. If it's older, a lot of times that's something where we're talking about a hip replacement. But otherwise, the sort of soft tissue aspect, so not in the hip joint itself, but surrounding, is very, very common. People get bursitis or inflammation of some of the areas around the hip, and that can be very, very painful. And it's probably one of the more common things that I see.
What are the differences in a hip injury compared to an athlete, an NFL player, or even just any athlete of that sort, and say me or just a normal person?
Yeah, a lot of it is truthfully, a lot of the injuries themselves are not necessarily different. The mechanisms are going to be different. So it's probably going to be a higher energy for an athlete. Like, again, the explosiveness and sort of the rapidity and the repetitiveness of the muscle firing. But a lot of it is like the expectations, I think, of the patients. Like you or I may not have the desire or motivation or need to get back super, super quick. And so I think like the intensity of the rehab is a lot more in an athlete.
And how do you assess whether or not it needs to either be a surgical procedure to fix an issue or it's non-surgical? How do you go about kind of deciding those two routes?
So most things we try to treat without surgery, because if so, it's sort of the less risk associated with that. And a lot of times it's all that people need. And so, but if people are failing what we call conservative treatment, where it's, physical therapy, medicines, sometimes there's a role for injections, then sometimes it needs more advanced imaging. Like if what we're seeing in clinic or on exam isn't matching up with how the patient is doing, sometimes it needs, an MRI or a CT scan to take a better look at either the bone, muscles, the labrum, things like that. And that can help guide our decisions.
And with hip injuries and things of that sort, how can you go about maybe preventing a hip injury? Especially for athletes, because it seems like a lot of it may just be you get hit at the wrong time in the hip, and that brings out a contusion, a hip pointer, things of that sort. But for the more, I guess, inside, like with the actual hip itself, how do you prevent those types of injuries?
I think it's hard. I think a lot of it can be sort of as you were sort of alluding, or like, in simplified terms, can be bad luck. Wrong place, wrong time, wrong positioning can cause these things to happen. But the things that people can do is try to build a solid foundation, and sort of, it starts with, probably what people were told, whether or not they wanted to do it or not when they were growing up playing sports. But warming up and cooling down are very, very important. Like nobody wants to do it, but it makes a big difference in sort of loosening things up, both on the front end and the back end, for injury prevention. I think cross training is important. I think if you do the same things repetitively, the muscles that are not involved in that particular activity are not going to be used as much and are probably more prone to be injured. And so I think, being diverse in sort of the physical activities that you're doing, even if you're an athlete, but sort of on the, in the off season, things like that, I think can be very important. But I think also like knowing your own limitations, and, there's that mantra that you want to sort of play through it, but sometimes that's not the best thing. And like a short period of time where you're not playing or resting to prevent more serious injuries down the road sometimes is probably the best way to prevent bigger things from happening.
Dr. Resnick, you brought up the cool down period, the warm up and the cool down. I go to F45. I do my warm ups. I do the stretches, do all of that, but I always skip the cool down because I'm like, I just finished a really intense workout. I don't feel like getting on the ground and doing more stretches. Why is a cool down important?
I think it's important because I think it prevents those muscles from really getting tight sort of on sort of the back end. And so you've worked, you've warmed up, and then there is sort of slowly cooling those muscles down and sort of stretching them that second time, I think can be very, very helpful.
That makes sense. You've convinced me a little bit. And here, I did notice your Colgate lanyard.
Yeah.
I do have to ask, I went to JMU and my JMU career was bookended with Colgate beating JMU in the FCS playoffs. But since attending Colgate, are you exclusively a Colgate toothpaste guy, or do you still use Crest?
It's hard to buy Crest in the supermarket when when you have that. I don't know if one's better than the other, nor it doesn't really matter. But yeah, I probably definitely more inclined to get Colgate toothpaste.
I'm always curious with that with Colgate alums. Dr. Resnick, where can listeners go to schedule an appointment at OrthoVirginia for hip injuries, concerns, and everything like that?
Yeah. So OrthoVirginia, our website, great place to start. Definitely has information about phone numbers you can always call to set up and schedule an appointment. Also has avenues for patients to schedule appointments online for both new as well as pre-existing patients.
Awesome. Dr. Resnick, thank you so much for taking some time out of your morning to chat with us. Have a great rest of your Wednesday.
You as well. Thank you for having me.